Dear medicos, welcome to Indian Anatomist. People who want to become doctors are free to check out the YouTube channel, Indian Anatomist. Do you know about the soul gland? Dear students, I am going to discuss about the thymus gland. Greeks believed that the thymus gland houses the soul. So, the thymus gland is called a soul gland. Thymus gland is a pink, asymmetrical, bilobulated lymphoid organ involved in immune system. After puberty, the gland is involuted and slowly replaced by fibrofatty tissue. The gland is situated in lower neck and thoracic cavity. It lies behind the sternum, that is retrosternal in position. The lobes of gland is divided into lobules, and lobules are divided into cortex and medulla. Embryologically, the gland is derived from endoderm of third pharyngeal pouch. The thymus gland belongs to endocrine system. It is an organ of the immune system located in the thorax and lower neck. The gland is located between the lungs in the chest, but posterior to the sternum, retrosternal, and comprises the superior and anterior mediastinum. The thymus glands surround the fibrous pericardium of heart. It facilitates the maturation and functioning of T lymphocytes or T cells, which play a vital role in the immune system. Now coming to the size and shape of the thymus gland. The gland is relatively larger in infants and children, reaching its maximum size during puberty. However, it gradually atrophies, and is replaced by fibrofatty tissue in adulthood. Overall, the thymus gland is pyramidal in shape, with two lobes, that may be fused or separated by connective tissue. Lobes are further divided into many lobules, that are separated by interlobular connective tissue septa. Under the microscope, each thymic lobule is divided into Number 1, cortex, the outer region that contains dense population of T cells or thymocytes and epithelial cells. And number 2 is medulla, the inner region that contains more mature T cells and degenerating T cells. The coming point is very important to identify the thymus gland under microscope. As the individual's age increases, the hasals or thymic corpuscles is a eosinophilic body composed of degenerating epithelial cells are found in the medulla. The number of thymic corpuscles may increase with age, initiates the involution of thymus. How the thymus gland is developed. The thymus gland developed from two elongated thymic diverticula, which grew from the ventral portion of the third pharyngeal pouch, located on both sides of the primitive pharynx. The thymus plays a vital role in the development of T cells, a subset of leukocytes or WBC, that participate in immunological reactions. Immature T cells or thymocytes migrate from the bone marrow to the thymus, where they undergo a process of maturation. Following maturity, T cells exit the thymus gland, and migrate to other non-thymic lymphoid organs located throughout the body. Now coming to the functions of thymus gland. Several thymus hormones help T lymphocytes develop and mature. These hormones are essential for immune system function. Some important thymus hormones are: Number 1, thymosin. This hormone helpful for T cell differentiation and maturation. In addition, thymosin regulates the immunological system. Thymosin alpha-1 receptor is being explored for its immunomodulatory activities and possible therapeutic uses in immune-related illnesses. The second hormone is thymopoietin, another thymus hormone. It develops and matures the T lymphocytes. Thymopoietin and thymosin govern T cell development and function to regulate the immune system. And the third hormone is thymulin, regulates the immunological system. T cell maturation and immune response modulation are its functions. Zinc deficiency affects thymulin function and T cell development. Overall, when a person is young and active, the thymus produces many of these hormones, but it declines with age. During involution, the thymus shrinks and function less. Though transformed, the thymus serves the defense system throughout life. Students, what is involution of thymus? The thymus undergoes a process called involution, where it decreases in size and activity with age. By adulthood, much of the thymic tissue is replaced by adipose or fat tissue. Despite this, the thymus continues to play a role in immune function throughout life. Now coming to the gross anatomical relationship of thymus gland, if present. Anteriorly, it is related to manubrium, at superior mediastinum, and body of sternum, at anterior mediastinum, till fourth costal cartilages and sternohyoid and sternothyroid muscles. And, posteriorly, it is related to left innominate or brachiocephalic vein, superior vena cava, ascending aorta, and right lung. Dear students, for detailed relations of superior and anterior mediastinum, please see the link given in description box, for your convenience. Blood supply of thymus gland. Arterial supply comes from thymic branches from internal thoracic artery, inferior and superior thyroid arteries. For venous drainage, most of the gland drains into left brachiocephalic vein, internal thoracic vein and inferior thyroid veins, occasionally drains into superior vena cava. Now, lymphatic drainage of the gland. Lymph drains into brachiocephalic, tracheobronchial, and parasternal group of lymph nodes. Nerve supply of thymus gland. Because it is a gland, it is supplied by autonomic nerves, that is parasympathetic and sympathetic. Parasympathetic innervation comes from vagus, the 10th cranial nerve. Whereas, sympathetic innervation comes from cervical sympathetic chain, that supplies the blood vessels of the thymus gland. Finally, the thymic capsule is supplied by phrenic nerve, carries the proprioception impulse. Last, but not the least, let us discuss about the applied anatomy of thymus gland. The thymus needs insulin. Insulin, growth hormone, and insulin growth factor, enhance lymphocyte proliferation in the thymus medulla. Type 1 diabetes affects the thymus, lowering immunity and other complications. In myasthenia gravis, organ hyperplasia causes thymus hyperactivity. This can also occur with thymus tumors, lymphomas, systemic lupus, and hyperthyroidism. Pallor, lymphadenopathy, rhinorrhea, and tonsillitis result from thymus hyperactivity. Vitamins A, D, calcium, and iodine treat this disease. Age-related thymus reduction makes humans more prone to disease. Changes in thymus size and function diminish and alter T cells. This function change can cause autoimmune diseases, bacterial and viral infections, and cancer. Thymic repair or pre-involution treatments may protect adult immunity. At last, many congenital diseases cause thymus atrophy. The thymus fails to grow in utero in DiGeorge syndrome. This agenesis causes immune system immaturity and repeated infections. A hereditary disorder called severe combined immunodeficiency, SCID, causes thymus disintegration and T and B lymphocyte depletion in children. Dear students, hope you enjoyed this session about anatomy of thymus gland. Please add your comments or advice in comment box. Dear students, hope you all enjoyed this session. Please like, comment, share, and subscribe. Good day all.